Good afternoon, everyone, and welcome to our NYU Returns webinar for faculty. I'm Carlos Ciatoli, the lead for our University COVID Prevention and Response team, and with me is Gigi DePico, Vice Provost for Academic Affairs. We're going to both give some brief introductory remarks and then go to questions. But before we jump there, just a couple of logistics. Just a reminder that the session is being recorded. We will go through the questions that were submitted in advance. You do have the opportunity to ask some additional questions through the Q&A. And if we have opportunity, we will try to get to them before the end of our session. So I'm going to jump in the interest of time and let people know that I think the semester has gotten off to a good start. I think the picture certainly broadly is a little more optimistic, I think, than it's been in the recent past. Case counts, frankly, globally, nationally, in New York City, have all been going down. New York City now for several weeks. Although we had an initial blip in our case counts at the start of the semester, which we fully anticipated as we brought back 50,000 students and engaged in welcome activities, we have for the last 2 weeks seen our case counts drop. And while it isn't posted on the website yet, I can give people a sneak peek into the fact that both our case counts for last week and our test positivity did go down a significant amount. So that's all encouraging that our strategies, at least for these first couple of weeks of the semester, seem to be working quite well. I'll reiterate the point that even with some detailed analysis, the classrooms continue to be an exceptionally safe place. As I've shared with others, I can't imagine a safer place to be in society where you've got about 99% of your population vaccinated, everyone is wearing a mask, anyone who has tested positive is blocked from entering. And that has played out, I think, in the work that we've been doing, in the analysis that we've been undertaking. And it's not just true here. I think we've been seeing that across the board. I will also share that much of what we go over today will be included in an email that will be sent out to faculty either later today or at the latest early tomorrow, which touches on a whole host of issues, including contact tracing, which I know is of particular interest for this group. So I will stop there and turn it over to Gigi for some opening remarks as well.
Thank you, Carlo. So on behalf of the Provost's office, I want to say thank you to all our faculty for all you're done, all you continue doing for our students. We're hearing from students across the university, from both first and second years who are setting foot on campus for the very first time, to graduate and professional students, to the international students that, dispelling our fears that they might not be able to get here, have arrived in New York, how happy they are to be physically present at NYU, and how especially happy and grateful they are to be in your classrooms. We know that for all the energy and excitement of reconvening in person, there's also been some understandable apprehension about the return to in-person teaching. We're hoping that as the semester continues, we're now in week 4, that many of those concerns, in particular about possible classroom transmission, you've just heard Carlo's explanation, are allayed. And mostly we just want to express our gratitude for all you've done to get us through the beginning of the semester. Finally, I want to thank you also for your continued flexibility with students. As you know, we've advised all students, the same is true, of course, for faculty and staff who feel in any way unwell to please stay home and get tested rather than going to class. Your efforts to help students keep up in whatever way is most appropriate to your discipline and your specific class is greatly appreciated. And then if we could put, there is in the chat, a document for teaching temporarily remote students outlining some of the strategies that you might use to do so. I believe most of the questions today are for Dr. Ciatoli, but we're also always happy to answer any academic questions you may have. So please feel free to reach out at any time. Carlo, back to you.
Thank you so much, Gigi. So the first question that got submitted How are you responding to the impact of the Delta variant and breakthrough infections? So I'll answer that in a couple of ways. First, one of the things that I am trying to do is ensure that I actually have the facts, that I'm following the science. Certainly throughout the COVID pandemic, the headlines and the facts don't always match. So I have been somewhat meticulous about going back and ensuring that we are following what are facts, the true evidence in all of our strategies. And then to say that we have always had a multi-layered approach to safety on campus and managing the COVID pandemic, that we have been flexible in almost every arm of that multi-layered strategy, and that the university has really, I think, been all in on ensuring safety first. I think that was manifest with our vaccine requirement. I think we were one of the first schools to come out with a vaccine requirement, not the first, but certainly one of the first. I think we took it seriously. We have resulting very high vaccination rates on campus, almost universal. I think you've seen on the website, collectively, we are probably somewhere about 98 to 99% fully vaccinated at this point. So it puts us in a very good position. And again, we will continue to follow the science, we'll continue to follow trends and act accordingly. We always knew there would be breakthrough infections even before the Delta variant emerged. The clinical trials on vaccines showed that they were 95% effective. I think everyone was thrilled with that, but there was the implication that some people would get infected afterwards. With that said, I think we are still seeing that vaccines are highly effective. There's a 5 times risk reduction for infections, greater than 10 times for hospitalization, greater than 10 times for death. So the vaccines are in fact working. It sets us up quite well, I think, for managing Delta moving forward. The second question and the next couple of questions really have to do with managing positive cases and contact tracing. So I sort of lump them all together as the next couple. I'll address them individually, but it will come one after the other. So the next question is, could you please define what constitutes a close contact and go over the process for how positive cases are handled when the individual is attending in-person class? In other words, who is contact? If the student informs faculty, who, if anyone, should they tell, etc. So the definition, I think, as we've shared before, of close contact is being within 6 feet for more than 15 minutes of someone who is positive. And the process, which again, this is fairly well delineated in the email that will go out, is that once we're informed, and we get informed of anyone who tests positive through our testing program. So if they test through BioReference, if they test through Binks, our team gets immediately informed of that. So we then know. If they test positive outside of that, we get informed through the self-reporting form. And people have been good, students and employees, faculty have all been good about self-reporting. So we have been capturing what we think is really the broad group of people who have tested positive. Anyone who tests positive that we're aware of has their ID card deactivated so they can no longer access buildings. They're instructed to go home. They are asked to fill out an intake form, which includes identifying close contacts with that definition of close contacts. And we then call the student. If they don't fill out the intake form, we call them within an hour. If they do, we then call them upon completion of the intake form and go over it in detail. Now, whenever we put someone into our case management system, whether it's for being a close contact, for having symptoms, for being a positive case, it pulls in a host of demographic information in. So if my information gets put in as a positive case, it pulls in what school I'm in, what department I'm in, what my major is, whether I'm in a residence hall. So it immediately gives our team a host of information to facilitate the contact tracing. We then tell them what the sort of parameters are around when they can return. For most students, it will be, for any member of the community who's positive, roughly 10 days. It usually is what we call a symptom-based strategy, which is that their symptoms need to be resolving. They need to have no fever for 24 hours and be a minimum of 10 days from the time of first symptoms or the time of the test being positive. So for almost everyone in our community, because we've had very few who have gone on to have persistent symptoms, it has generally been 10 days that they will be out for. Again, during that contact tracing piece of this, we also can leverage class rosters as well to facilitate it. If needed, we can even access TAP information so that we can see where students may have been on campus in that period that they have been potentially infectious. The next question is, oh, and then just in terms of who to inform. So the student gets informed by us in terms of what they need to do. At that point, there really is no further notification broadly. The close contacts will be informed, and they won't have the person who's positive identified, which I know sometimes is frustrating if you're a close contact, because you may feel you weren't around anyone who was. For anyone who's vaccinated, close contacts do not need to quarantine any longer by CDC guidance. You are requested to test 3 to 5 days after your last exposure to that positive individual, which we give that information to the close contact. But there is no broader notification. So we don't then sort of broadly notify to a class, a workplace, or a residence hall. It is limited to those identified as close contacts. Now, if a student informs the faculty member, the question has come up, well, what should I do with that information, right? I don't know whether they've reported it to you. I don't know who their close contacts are. What I would say there is you can certainly remind the student that they should be reporting this information to the COVID prevention and response team, to the self-reporting form, because once that gets done, that is what triggers all of the other interventions. Short of that, the faculty member should not really be informing anyone else at that point. And I will say, again, that process has worked quite well through the first several weeks of the semester. Just to clarify a point in the Q&A, so does the 15 minutes of close contact with someone mean masked too? Yeah, so whether you're masked or unmasked, vaccinated or unvaccinated, the broad sort of definition of close contact still applies. Now, I will say within that, there's clearly, I think, different risk stratification. As I said, someone who's masked, vaccinated, is probably at less risk than someone who's unvaccinated, and if everyone, particularly the one who's sick, is unmasked. But by definition, that is how we define close contact for the purposes of contact tracing. Another question that came up related to this, if a student tells a professor they're positive, is the professor supposed to take the class online because they are closer than 6 feet apart? So the answer there is no. And frankly, the faculty member should really never be taking the class remote unless there has been a discussion between the faculty member and the dean and the CPRT, myself, because it is the rare circumstance that we would have to take a class remote because we would have to think that the class itself was a potential source of ongoing transmission. So there might be the rare class by nature of the activities in the class or through some other analysis, but as a matter of routine, that should not be happening. Let me just see if there's anything else in here. So how do we actually know in the tracing that transmission did not happen in the classroom? So what we can do is we can look to see, one, whether or not any of the contacts that are identified in the classroom were in the class. So we'll often see that there are clusters, and we can go back and retrospectively look. We've not seen that. Again, other institutions have not seen that. So it's strong evidence. In consultation with public health officials, they have uniformly said that if someone is vaccinated, if someone is masked, and someone doesn't have symptoms, it is highly unlikely that they would be in a position to transmit. If anyone in a classroom tests positive and you find out, are all others supposed to test? So the short answer there is no. I will remind people that if for whatever reason they feel particularly vulnerable, we have that discretionary testing, so people can at their discretion test, but we are reserving the sort of close contact definition for those who are identified by the infected individual as being a close contact. And then one more on this, for students who get breakthrough infections, and just to remind people, because we have vaccination rates as high as they are, almost every infection that we do have is going to be a quote unquote breakthrough infection, which again, should not come as a surprise to anyone or really be any cause of concern. Are we assessing how they think they were infected? So the answer is yes. So when we have a new positive case, we probe about what their potential exposures were. And that's part of the reason I think that we've got confidence that this is not happening in the classroom. Overwhelmingly, what we're hearing is it was in a household exposure where people are unmasked, or it was in a social setting, often eating where masks are down and people are interacting for a prolonged period of time, talking to each other face to face. So that is asked on the intake form. So I think the next question we've answered, which is what do I do when a student in my class tells me they tested positive? Should I alert the rest of the students in the class? Again, the answer there is no. Remind certainly the student who told you that they were positive to self-report using the self-reporting form, but otherwise there should be no broad classroom notification. Question, what do we do if 2 or more students in the same class have COVID? Again, same various actions apply. Ensure that they're self-reporting, but there really is no other action. I know there's sometimes the temptation to think that somehow the class is implicated because you might have 2 or 3 in a class. But again, when we've done the analysis, there is always an exposure outside the class. And it's not surprising, frankly, for some of our students who share academic time together, that they're sharing social time together as well. What happens when an instructor is tested positive and might have infected students in their class? So same rules apply there. The instructor should email us. We would go through the same intake process. You would share, whether you were masked, unmasked for whatever reason. But again, the likelihood would be low. But to that end, you could identify anyone in the class that you felt met definition of close contact, and then those students would be notified. And then another question, I feel 100% fine and I am vaccinated, but someone in my family is sick with something that may or may not be COVID, not having tested yet. Should I come into work? So I think, yes, if you're feeling fine, if you're vaccinated, you're following all the rules, you can certainly continue to come into work. I would say 2 things there. Have a low threshold to stay home if you're feeling any symptoms. And then certainly if the person at home does turn out to be COVID positive, you should be following up on that testing as well. And I would say that is another indication to report to the COVID prevention and response team through the self-reporting form, where your close contact is happening outside potentially of sort of the NYU community. I'm going to pause, I think, on some of the public health questions. Gigi, turn it over to you for some of the more academic focused questions for now. You're muted, I think. Or is that just me?
No, you would think that after all this time, I would know that. So I'm going to respond to some of the questions that were submitted ahead of time and some that have come in the chat right now. So there was a question concerning computer equipment in the classroom and whether faculty need to continue to bring and hook up their own laptops. With the dramatic increase in the use of laptops in classrooms, the university purchased hundreds of additional classroom laptops over the summer, but the global chip shortage and supply chain disruptions meant they weren't all delivered in time for the start of the semester. Most rooms that need laptops now have them or should have them, and we're installing new equipment as it comes in. If you still need and don't have a laptop in your classroom, or you have any kind of tech need, please reach out to your school's instructional technologist. And I think the link is now in the chat to the contact information by school. There was a question concerning an invitation to lecture in Paris in November and whether the faculty member could or should go. In general, best to avoid any international travel that's not necessary. France right now is a level 4 country. So on its website, the CDC is recommending avoiding travel to France unless it's crucial. We're putting in the chat the CDC and the State Department's travel advisories, as well as NYU's travel policy. The NYU travel policy is that travel to level 1 and level 2 countries, as rated by the Department of State, is permitted and doesn't need to be submitted to the Travel Review Committee. And whereas travel to level 3 and level 4 countries does need an exception from the Travel Review Committee, and you can submit your request to travelsafety@nyu.edu, and that is also in the chat. There was a question concerning individual development accounts at the College of Dentistry, which had to be frozen last year to offset lost clinical revenue. And the question also asked about salary increases. Individual development accounts are again available for 21-22, as are all discretionary accounts. And any questions that you have, please direct to your dean's office. University-wide discretionary spending that's unrelated to teaching or research is being curbed somewhat, but all research and teaching-related expenditures are being fully supported. In terms of salary increases, the university is really grateful for all the hard work of our faculty and all our other employees during COVID. And for 2021, the university provided a 3% salary increase pool, which included a 2% COVID-19 salary adjustment pool and a 1% merit increase pool. There was a question about if a student is sick with COVID but feels well enough to attend our class remotely, can we allow them to do so? Yes, absolutely. If it is convenient for you to turn on Zoom or somehow make your class available to them in a hybrid blended format, then yes, that's very welcome, but it is not mandatory to do that as long as you provide them with some way of keeping up. And then there was a question about the 7-foot rule between professors and students. And just a reminder that with all the various measures in place, including the vaccine mandate and the mask requirement, that physical distancing in the classrooms is not required. We were able to, it was done largely for pedagogic reasons in the lecture classrooms, and also because those are bigger, to create those instructor zones. But in seminars, faculty may move chairs around either to create instructor zones or to move the class closer together. Obviously, if any student who is unvaccinated and exempted needs to sit apart or would prefer and be more comfortable sitting apart, then we would ask that you honor that. Carlo, back to you.
Great, thanks, Gigi. So I'm going to try to get through at least all of the other pre-submitted questions in the next 6 minutes. Next question, since all students and faculty are expected to teach in person, NYU leadership ought to provide guidance of the truly protective masks, including KN95 and N95 for faculty who are vulnerable. Why isn't the university continuing to provide PPE? So the university is continuing to provide PPE in the form of the surgical masks and other face coverings. N95s are really reserved for those who are interacting in extremely high-risk situations in the clinical setting where aerosols are being generated, like at the School of Dentistry, or where clinical staff are in a respiratory unit. Even in conversations I've had with Langone, the average clinician at Langone is only wearing a surgical mask day in and day out. So again, this is an example of us following the guidance. Certainly, if any individual wants to on their own go out, and we're not necessarily recommending it, but we're not really preventing people from doing that on their own. But again, there are a host of issues with both KN95s and N95s in terms of obtaining them and using them day in and day out. What does a faculty member do if a classroom has no apparent air circulation? And then a second piece, a second separate question, is there a record of where NYU installed HEPA filters and some kind of reporting on how the air filtration has been installed? And I will answer that really with a broad overview of where we are with our ventilation throughout our buildings. The university's facilities and construction management team did a fairly exhaustive review and survey of all university buildings in both Brooklyn and Washington Square to ensure that they were compliant with CDC recommendations. And that included introduction of outdoor air by opening the air dampers, increasing the minimal settings of the HVAC system so they draw in at least 25% of circulated air from the outdoors, that the systems operate properly and provide acceptable indoor air quality for different occupancy levels, disabling demand-controlled ventilation that sometimes can increase airflow, improving central air filtration without reducing design airflow. All the filters are appropriately sized and up to date. And just to highlight, I think something that had happened certainly at the end of the summer where classrooms felt warmer. That was in part because, again, they were bringing in more quote unquote fresh air from the outside, which would make the classroom feel a little bit warmer, but was in fact, from a ventilation, infection control perspective, the right thing to do. And then finally, there is information about who to contact if there is an issue with a room, particularly temperature. There is FCM's Client Service Center. The extension is 81001, or contact csc@nyu.edu is the email alias as well. Several questions, I think, on booster vaccines, and I think I even saw it in today's Q&A. So I think people saw over the last week, the FDA, the advisory panel, the full FDA, the CDC advisory panel, the full CDC sort of had varying opinions on what to recommend. Ultimately, the CDC director has the final say on formal recommendations. So there are two groups that, quote unquote, should get a booster vaccine. And right now, I have to remind people that is only for people who initially got a Pfizer series initially. And those people are those over 65 or those between the ages of 40 and 64 who have underlying medical conditions that would put them at risk. And there's a fairly detailed, lengthy list of conditions that would do that. So that's groups 1 and 2 that should. Then there is the may get a booster vaccine, and those are those between the ages of 18 and 49 that have those underlying conditions, and those in certain occupations that might put them at greater risk. And that's, I think, the category where much of our faculty may fall. The phrase teachers, or the word teachers, was put out as part of that. When I reached out to the City Department of Health, they said that they felt that the intention of that was really K through 12. There may be some flexibility on that, so I would say stay tuned. If you fall into either of those first two groups, for sure, you will have opportunity to get vaccinated. To those of you who got vaccinated at Langone, I think they will soon reach out to patients to provide that. I think we get our vaccine from the city, so we will reach back out to them and see if we can make booster vaccines available in the near future as well. And then the impact on booster vaccines on the Excelsior Pass, I think because it is not yet a mandate, I don't know whether the Excelsior Pass will update with boosters or not, or if there's a way to flag that. I think everyone should just stay tuned. I don't know the answer on that one. A question, why have you made it so difficult for faculty to challenge the decisions made by the COVID team? Do you not want faculty input? For example, why do we have to do the screener anymore? Do you not trust faculty to follow the requisite guidelines? So there I would sort of challenge the notion that we've made it difficult for you to challenge decisions. I think this is the third faculty webinar that we've done in the last month. We did 2 at the end of August, one for full-time faculty, one for adjuncts, and this one as well. I'm in routine contact with the faculty council heads. We have routine dean's meeting in which faculty issues are routinely raised. So I would say the faculty group has probably provided the most input on what's happening, and we certainly welcome input from the entire community, because it is how we will get things right and think through the implications of all our decisions. And then specifically on trusting the faculty, I think we trust the entire community. But as Ronald Reagan said decades ago, trust but verify, I think is the approach we've taken. And specifically on the screener, it is actually now a requirement of the state that we continue to screen. So for now, we will continue to have people complete the daily screener. And then lastly, a minute over, NYPD officers have repeatedly been observed entering NYU buildings unmasked. The rate of vaccination among NYPD officers is abysmally low, creating a point of vulnerability for the NYU community. What is being done to address this? Why are NYPD officers continually permitted to enter NYU buildings unmasked and without filling out the daily screener required by all who seek to enter buildings? So, you know, when I posed this to our head of campus security, Fountain Walker, he said it was the first he was hearing of this since school has started. So again, the only time that NYPD really should be entering are under urgent or emergent situations in which obviously filling out the daily screener is not practical. They should all be masked upon entry. Campus safety will ask them to mask if they are not when they enter buildings. And I think if any community member sees that a member of the NYPD has entered without a mask, they can certainly let campus safety know by dialing the main 82222 number so that they can reach out to the local precincts and make them aware. So we are actually 2 minutes over, but we did manage to cover all of the questions that got presented. So I am going to just thank everyone again. Gigi, my thanks to you. And I don't know, Gigi, if you have a final thought as well.
If we left any questions unanswered in the chat that came in today, we will get back to you on those. And as always, please feel free to reach out to us.
Thank you all. Have a good day.
Thanks.